CDC will no longer recommend masks indoors unless communities have a high level of COVID spread. Now, it hasn't changed transportation guidelines for airlines, but the guidance does include schools.
The loosening of the guidelines raises questions. How safe is it to take off the mask? Medical reporter Liz Bonus shares some answers.
Hey there, everybody. These newer recommendations by the CDC take into account current caseloads, but also hospitalizations and capacity of local hospitals.
When we were at our peak, probably around mid-January of this year, we had over 1,300 admissions.
Now, infectious disease specialist Dr. Thomas Lamar told me Ohio's Christ Hospital and those surrounding it down to less than 300. When it comes to masks, that should mean it's medically safer to take them off in indoor settings.
But the reality is that even at low levels, a virus can remain virulent and can still cause, high levels of morbidity, mortality.
So here's what he says this relaxed mask guidance means for all of us.
At some point, however, a society has to decide, how much disease do they want to live with.
If you want to live with very little, here's what to ask before you take off the indoor mask. How big is the space? How is the airflow? Are people exerting in it? And am I fully vaccinated?
The reality is that most of the risk is probably the individuals you're with and less the people around you.
He says it's still likely that in certain settings, such as a doctor's office or a medical setting, you'll be asked to still wear a mask. Now, that is mainly to protect those most vulnerable around you, not because you are not safe in that environment. I'm medical reporter Liz Bonus. Now back to you.